Good afternoon, everyone
Good
present
afternoon,
here. I
everyone
am
present
Faraz
here.
from
I am
IGCP
Faraz
Group.
from
Welcome all the
IGCP Group. Welcome
participants on
all the
today's live
participants on
session.
today's live session.
And that is on a very
And that is
important
on a
topic,
very
that is
important
cold
topic,
wind,
that is
warm
cold wind,
noses,
warm
understanding
noses,
seasonal allergic
understanding seasonal
rhinitis
allergic
in
rhinitis
transition
in
weathers.
transition
And
weathers.
as we know that
And
this is a
as we
very
know that this
important
is a very
topic,
important
so we
topic,
need
so
someone
we
who is
need someone
expert.
who is
So
expert.
without any
So
further
without
delay, I
any
would like
further
to
delay, I
invite
would
our
like to
speaker
invite
for
our
this
speaker
webinar,
for this
none
webinar,
other than Dr.
none other
Vijay
than
Barat,
Dr.
sir.
Vijay Barat,
And
sir.
let me share
Let
some
me
of the
share some
achievement
of the
of sir.
achievement of
Sir
sir.
has done
Sir has
MBBS,
done
MD
MBBS,
consultant
MD
allergist,
consultant allergist,
pediatric,
pediatric,
pulmonologist,
pulmonologist,
clinical and
immunologist,
consulted
and
at Sai
consulted at Sai
Allergy
Allergy
Hospital
Hospital
and Shaidri
and
Hospital,
Shaidri
Imamdar
Hospital, Imamdar
Multi-Specialty Hospital,
Multi-Specialty
Pune
Hospital,
Allergy
Pune
Center.
Allergy Center.
So without any
So
further
without any
delay, I
further
would
delay,
like to
I would
invite
like to
sir
invite sir
and hand over
and
this
hand over this
webinar to sir.
webinar to
Over
sir.
to you, sir. You
Over
can
to you, sir. You can
proceed from here.
proceed from here.
Thanks for the introduction and thanks to giving me the opportunity to discuss my experience of more than 25 years in this field. See, as recently we have seen so many floods from Uttar Kashmir, even in Maharashtra, the rural areas where there used to be a drought, but we had a floods. In Pune like city, a lot of the rains are there. The fungus is molds. We are seeing a lot of fungal pneumonia and all. So changing scenario, if you see, and this picture you can see like how these changes are affecting the whole uh, Indian scenario. As working with the environmental committee of Pune Municipal Corporation and American College of Allergy and Immunology, we found that there has to be awareness about these environmental factors which are causing the changes into the health. So not only this, just respiratory and all, even the gut problems, to skin problems, to even it has a lot of complications on the body, even neurobehavioral problems. So allergic rhinitis today's topic. It is not a lower immunity. There is a lot of misconception. It is a hypersensitivity because of the allergens and pollutants which go on changing these things. And as the weather changes, the cloudy weather, these allergens are sucked through the clouds and then they penetrate in a very big way. And then the humidity also affects the dust mites into the bed, sofa, curtains. Pollen potency increases as the global warming happens. And even from the newborn baby, which is having a eczema to cold problems or changing weather having a infections. And then it continues with the minimal persistent inflammation leading to the rhinitis, rhinosinusitis, the mucosa which is connected and leading to bronchitis, nasobronchitis, nasoocular reflex, then nasootitis, then the allergen swallowed causing the inflammation into the gut, and how this allergic march which leading to the asthma, then chronic respiratory diseases, then severe food allergies. Like just now outside, I'm having a child 6 years old. After having a milk, she was admitted to the ICU, severe vomiting and all. So the gastric inflammation has increased, leading to such a severe gastroenteritis like non-IgE mediated milk allergy. So these quality of the life of the patient is affecting, and then this gut skin axis leading to the skin problems as the weather changes. Now a lot of eczema is increasing into this weather, and these environmental allergens which cause the gut mast cell sensitivity, and then this inflammation through the nose, which is connecting these different parts of the body and leading to the gut health problems and gut microbiome change. So not only there, even the microbiota in the nasopharynx, nose, oropharynx, airways, they also play a very important role. That's why now respiratory therapies are coming up with the specific probiotics also to reduce this inflammation and changing healthy watchmans in our airways basically. So if you see amongst these allergens, the grass pollen, tree pollens, insect droppings, animal danders, dust mites into the beds of us, funguses, and some of the patients have a severe food allergy also. So they are non-visible. You can't see them. They come through the air, so you can see like how they are so microscopic. So if you see in the sunlight, something is floating into that. So these dust mites into the bed,
The fecal cause
sofa, curtains,
sends most
daily
blood
around
to the
1.5 gram
feet.
of our skin is shredded,
Yeah.
and more than 1.5 gram of skin, 10 to 15 lakh dust mites are formed. Then pollens, they are identified with the specific instruments and they are collected. So people are worried about the cancer, but now chronic respiratory disease is a very important one. And this allergy asthma COPD overlap is very well. So we have to identify the patients with the venous stasis causing a dark circles, wrinkle, Denny Morgan folds, long eyelashes, watering of eyes, discharge, rubbing of the eyes, nose, and ears, open mouth breathing, halitosis, bad breath, white coating of tongue, posterior pharyngeal hyperplasia, cervical lymphadenopathy. This because causing the inflammation and the turbinate hypertrophy, derriere line. Then this doing this facial grimaces, hypertrophy terminates, and the posterior pharyngeal hyperplasia. So the rubbing of eyes leading to the rhinoconjunctivitis. Many 95% of the children have that. The nasoocular reflex, the nasolacrimal duct inflammation. And these are these pollutants and allergen funguses they go inside and then causing this keratoconus, early age cataract glaucoma because of the pressure and all. Then angioedema, swelling of the eyes, Seals ulcer, leading to such a complications requiring very higher medications like omalizumab and all. So in pediatricians OPD or in adults also. Now the pulmonary function testing should be done in these patients. Identify with the lung inflammation, and once we identify early stages, we can prevent these complications. Like this patient had been to many patients, failure to thrive, not gaining weight and all, required invasive medications and all. But if you see this failure, so it's significant failure to thrive, protruded jaw, turbinate hypertrophy. This was a skin inflammation with three admissions with severe bronchitis. So once we identified these dust mites and we desensitized, he had a very good recovery. This patient would have post hypoxia admitted in ICU, and dust mite sensitivity contaminated into the peanut butter. So this TH2 inflammation into the upper airway is very important. So secondary infection happen and weather changes happen. The people talk about the viral infections. They treat the viral infections, but the TH2 inflammation continues, and then the inflammation leads to the secondary infections. So this this way, or doing sneezing or tonsil adenoids, throat infections. So the palatine tonsils is a TH2 inflammation. So the initially the patient have a inflammation here. So most of the patients will have a blocked nose or sneezing or rhinorrhea, snoring, upper airway, strained breathing, difficulty in then colds repeatedly. But later on, they go to the lower airways and other parts of the body also, and some of the patients have a overlapping symptoms. Simultaneously, multiple symptoms will be involved. And chronic respiratory diseases should be stopped with the proper management of inflammation. So while managing these patients, the nasal douching, the nasal steroids are very important. Then the diet also should change, microbial, vitamin D3, zinc supplementations, and other comorbid disorders also should be treated very well to control this inflammation. So if you see the safe second generation antihistaminic should be used, then some of the patients with a very severe allergies, now monoclonal antibodies like omalizumab, mepolizumab, benralizumab can also be utilized. So we have to identify the specific part of the body and the sensitization which is happening with the multiple inflammation. And once that threshold reach, the patient have a hypersensitivity. So out of that, 50% will have asthma. Then out of 90% of the children with asthma have rhinitis. Adults also 65 to 80% have allergic rhinitis. So these are the primary culprits, and you can see so much percentage wise. So even JINA asthma guidelines, the allergic responses should be managed. Allergic testing should be done along with the pharmacotherapies, and then avoidance measures and desensitization is the long-term disease-modifying therapies. So allergic rhinitis is the central part, and then along with that, the patient will have a different type of presentation. So early part, identify identify the comorbid condition, use the nebulizers also, nasal steroids, inhaled steroids, or after that allergy testing, some simple precautions can make a lot of difference these patients. So identify with the medical proper, do the test, avoidance measures, and very few patients require a blood specific IG for the food allergy. If there is a significant food allergy also, having anaphylaxis or leading to the severe symptoms. So standardized skin allergy tests are the best one in the world. It is a painless bloodless, hardly 100 rupees per allergen, because they pick up the mast cell bound IG than the circulating IG. So even the newborn baby also you can do that. And those patients actual food allergy within 2 to 3 hours after eating they have a runny nose or choked up or swelling and all, then the CRD test also can be done. So these are the components where we can identify which different proteins that cross reactivity. Like grass pollen have a cross reactivity with foods, then dust might have a cross reactivity with prawns, cockroaches. So accordingly, like somebody after Sankranti, we used to have a lot of cystic seed allergy patients. Then latex cross reactivity with the many fruits. So depending on that, and some of the patients have a insect anaphylaxis also, along with the rhinitis. So we are doing studies into that. So people have a misconception about the food allergy, but the food allergy is very less. Actually, the dust mites, pollens, and molds is very common. So once we identify that, then we guide the patient like what type of bedding should be there. Then intense sunlight, the beds can be kept. And pollens, use the mask while going to the office or going to the school. The children can use the mask properly. The pets should be kept outside rather than on the bed and sofas. Cockroaches, the pest control can be done. The fungus humidity then 5% liquid ammonia can be used to and the control the humidity also you have to manage. Then safer medications like second generation antihistaminic like fexofenadine, elastin, monthly acid in some of the patient as add-on therapy. And door where we can avoid, then we have to desensitize with the allergen vaccines. So these form the antibodies against the specific allergen IgE, and then these specific IgG1, IgG4 antibodies are formed. The further eosinophil and the inflammatory cells go down, improve the quality of life, and reduce the inflammation into all these even rhinitis, ocular allergy, asthma, skin or food allergy. So long-term wise, the improved efficacy with the sustained efficacy, prevention of the liver sensitivities, prevention of the complications, rhinoconjunctivitis, asthma, chronic respiratory disease. These are the specific IG mediated diseases. Rhinitis is the central part and then connecting the other organs. So TH2 inflammation to the TH1 immunity so that the further inflammation. Even World Health Organization has said that desensitization and allergen avoidance along with the safe antihistaminic nasal steroid, nasal sprays are very helpful and some of the patients probiotics or some of the patients with the identifying the specific interleukins we can use the biologics or depending on the eye steroids also can be used temporarily. So these are the targeted therapies where we can reduce the inflammation and stop the further progress. Like omalizumab is the age old, and long term wise, the medicines also will be reduced, and the immunotherapy which will reduce the overall cost of the patients. And depending on the weather changes, how this rhinitis is increasing, the rising temperatures, the humidity should be managed. Close the windows during the rainy, cloudy weather or when the breeze is happening. The pollen filters can be used in the car ACs, vents can be covered. Even the anaphylaxis, allergic rhinitis, asthma patients, many of them having anaphylaxis also later on. So now this year's World Allergy Organization's motto is to stop or prevent such type of complications. In so many years we are identifying these patients and guiding the parents or patients what type of precautions and all. So people feel like allergy is nothing to be worried. 80 crore people are taking anti-allergics in India and leading to these complications. So the awareness is required that hit hard and hit fast in whether AC, fan, ice cream, cold drinks, after soaking in the rains or traveling in the early smog and all. These are just triggers. The primary disease has to be managed to stop the progress to all these complications. Rhinitis is the early part. Then it leads to storing conjunctivitis, sinusitis, migraine, ear problems. 30% deafness is because of the rhinitis. Upper airway TH2 inflammation, repeated clearing of throat, repeated medications. So many homeopathic, Ayurvedic, allopathic, Unani, so many medicines are used. And symptoms are controlled, but the disease is progressing, leading to chronic respiratory diseases, severe asthma, anaphylaxis, severe food allergies, affecting poor quality of life. So the awareness is important that we should go to the root cause for the long-term wise, the environmental preservation, maximum plantations in-house, the dusting should be stopped. We should use a vacuum cleaning. Some simple precautions after the allergy test, dust mites, pollens and all, molds, animal dander, or pigeon feather or insect droppings and dried feather, even the rice weevil insects. or the cockroaches. Then pest control. Some of the allergens come with the vegetable fruits. Wash the vegetables and fruits. Keep the bag also outside, whatever the container. So these simple precautions. Always sneeze out, never sniff inside. These will be going inside. So these simple precautions, breathing exercises, pulmonary rehabilitation we call it. These also should be put in. Then some of the patients air purifier also can be used, plasma clustering technology. So these precautions can be taken and we should have a prevent these complications. So that way we can help the patients during this changing weather and controlling the rhinitis as a central part to prevent the complications to the other parts of the body. Thank you. Thanks a lot. Any questions are there?
Thank you so much, sir, for taking out your important time and sharing your knowledge on this topic. I definitely think this session knowledge is going to help all the participants on their practice too. Sir, I can see one question from Mr. Mukesh. He's asking, sir, among levocetirizine, fesoferidine, and blastin, which anti-asthmatic you suggest more safer during pregnancy, as well as safest steroid nasal spray for inhaler during pregnancy, sir?
Actually, during pregnancy, inhalers are also very safe. The formoterol budesonide combination or salmeterol fluticasone can be given in asthma patients. And fenzophenidaine is the most studied during pregnancy. But the newer ones like even levocetirizine and even the Pilastin, some of the patient depends on that. Specifically rhinitis and all, levocetirizine also tolerable, but we can't increase the dose. But some of the patient with the severe rhinosinusitis or pregnancy-induced skin allergies, then the fexofenadine can be increased dose. Otherwise, the mother may have a sedation and fall down. And abortion chances are there. Then inhaler nebulizer, depending on the patients, can be utilized with the expert doctor's advice. But most important is that along with these medicines, the allergen testing and the avoidance of the dust mites and pollens will reduce the medications because ultimately our aim is not to have many medications during the pregnancy. Ultimately, the child may suffer with that. So, rather than that, the safer medicines will be given, but identify the allergens, take the opinion of the allergy specialist, avoid some of the simple things so that we can reduce the medications.
Thank you so much, sir, for answering, sir. We will take one last question, sir. The question is, sir, how clinicians differentiate between viral rhinitis and seasonal allergic rhinitis in early phase or presentation, sir?
Very important question. Actually, suppose a patient has, because of the weather change, or after soaking into the rains, or after eating any ice cream, cold drinks, without fever, if the symptoms are there, it is mostly allergy. And once we give antihistaminic, immediately the patient has a response. Viral infections, they don't show that much response. Some symptoms will be reduced. The patient will have some sneezing, some rhinorrhea, then some weakness, feverishness will be there. And that is a viral infection. The viral infection lasts for hardly 5 to 7 days. But the allergic one lasts for more than 10 days. And repeatedly it will happen. Like within a 4 weeks, 4 times. Within a year, more than uh, 4 weeks duration continuous will be there. It is an allergy.
Thank you so much, sir, for answering this question, sir. I can't see any further question. You have done a very beautiful presentation, sir, and covered the very practical aspects. I hope, sir, it will be very much impactful to all the participants and the PG students who are practicing and help in their practicing too, sir. Sir, as there is no more questions, sir, Mukesh has written, thank you so much, sir, for answering my question.
Yeah.
Sir, I hope, sir,
Great.
you have done justice to this topic. Yeah, as there is no more questions, sir, with all your permission, shall we conclude this webinar for today?
Sure. Yeah. Thank you.
Take care, sir, and we would like to see you in future also with different topics, sir. It was great honor to have you, sir. Thank you.
Good. Thank you.